Welcome to the She Found Motherhood podcast. It's Dr. Alicia here, and today on our podcast we are talking all things twins. The more the merrier, they say. Dr. Sarah and I are going to talk about what causes twin pregnancies, how common they are, and how the care during pregnancy and childbirth differs from twins from a singleton. Look forward to talking to you right after this. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the fourth trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. Hey Sarah, today we are talking about something that I really love, efficiency. Twins, isn't that right? The more the merrier?
Well, Alicia, I'm not sure that it is so much the case with twins. Although they are pretty exciting, they also come with increased risks. And today, we're going to cover all that and more in our She Found Motherhood podcast.
Okay, you're right. Twins are fun and exciting, but they also come with some challenges. In today's podcast, we're going to discuss how common twins are, the different types of twins, how the care for pregnant people with twins differs from those who are pregnant with a single baby, and what the delivery might look like.
You got it. So let's get started. Twins make up about 2 to 4% of all live births. But we think that more pregnancies start out as twins, but our body naturally decreases them down to a singleton. We think that about 1/3 of pregnancies starting out as a twin pregnancy actually end up having what is called a vanishing twin. This often occurs in the first trimester, and sometimes even before we have an ultrasound and know we are pregnant with twins. If this occurs in the first trimester, generally there should not be an increased risk for the health of the remaining fetus or the pregnant person. Twins are more common in some ethnicities than others. For example, in Nigeria, there are about 50 out of 1,000 births, whereas in Japan it is much lower, about 1.3 in 1,000 births. Now this only applies to dizygotic twins, not monozygotic twins, which we will describe in more detail a little later. Other things that increase the rate of having twins are the use of assisted reproductive technologies and maternal age at pregnancy. When you compare a 35-year-old to a 15-year-old, their risk of having twins is 2 to 3 times higher.
Whew, that's a lot higher. So we mentioned a couple terms earlier, monozygotic and dizygotic. So let's chat a little bit more about the terminology of twins. First is zygosity. This means whether both babies came from a single fertilized ova. So this would be monozygotic. Or dizygotic, which come from 2 separate ova which were fertilized separately. So in the case of monozygotic twins, one ovum was fertilized and then split into 2 early on in the process. So these are otherwise known as identical twins. Dizygotic twins are known as fraternal twins, so 2 separate fertilized ova with different chromosomes. The next thing which we need to know about the twins is their chorionicity and amnionicity. This is what we're describing when we use the terms di-di, mono-di, or mono-mono twins. Now, this is really important for us to know about as there are different risks to both the babies and the mom with these 3 different types of twins. Chorionicity is the number of outer membranes associated with the pregnancy, and this also speaks to the placenta. Amnionicity describes the inner membranes. So in researching this article, I actually came across a really good analogy using houses and apartment buildings, which made a lot of sense to me. So I'm going to use that and steal it for this podcast. Thank you, whoever wrote that. So when we're speaking about chorionicity, we can think of separate side-by-side houses with their own water, their own electrical input, their own internet connections. They are relatively independent from each other, but live in close proximity. So a hurricane passing by would affect them both, but if the water line to one house ruptures, it shouldn't affect the other house. Unless it's a serious tsunami, then maybe. So this would be dichorionic twins. They have their own placenta supplying each of them individually.
That is really good.
Right?
Yeah.
Makes so much sense. So monochorionic would be like living in an apartment building. So the same main water line, the main electrical lines supply the entire building. So if the main water line bursts, it affects all of the apartment dwellers in the apartment. And this would be monochorionic twins.
Yes, I am loving this.
Amnionicity is whether there are two separate apartments in the building or whether they live together in the same apartment.
Oh, sick. This is so good.
Diamniotic is they have their own apartments, but they live in the same building. Monoamniotic is that they live in the same apartment, so they're roommates and dependent on the same supplies for everything. So how does this happen, Sarah?
Well, I'm so glad you asked. All dizygotic twins, so remember, these are two separate fertilized ovums, are diamniotic and dichorionic. They have their own houses on the same street, painted their own colors, etc. Monozygotic twins can be any of the three, and this all depends on when the fertilized single ovum divided into two. If the fertilized ovum separates between days 0 and 3 after fertilization, they become dichorionic and diamniotic. So they become neighbors on the same street. If the fertilized ovum separates days 4 to 8 after fertilization, they become monochorionic, diamniotic, separate apartments in the same building. If the fertilized ovum separates day 9 to 12 after fertilization, they become monochorionic, monoamniotic twins. Roommates in the same apartment in the same building. Now, if they separate after about 13 days, then they often can be conjoined twins. Now, these are relatively rare, less than 1% of twins, and we will not be discussing this any further during the podcast. The best time for us to find out what kind of twins you have is around the 8 to 10 week of gestation by ultrasound. So why do we need to know this? Well, the closer the neighbors, the higher the risks are to the fetuses. And generally, the more closely we need to follow and earlier we need to deliver.
So now that we know what type of twins we have, what does that mean in terms of care? So in all twin pregnancies, we need more energy to grow these little babies. So energy needs or caloric needs increase by about 10%. We also need more micronutrients, including folate, iron, and calcium. So making sure you talk to your care provider or a registered dietitian about what this should look like for you. I often say to people pregnant with twins that twice the babies usually means twice the visits or more. So in our community, we share care with our obstetrical colleagues. And so your primary care provider will see you as well as an obstetrician. In other communities, your care may be transferred to an obstetrician from a midwife or family doctor once you're diagnosed with twins, as you're now considered a higher risk pregnancy. If you're pregnant with mono-di or mono twins, so same apartment building, either separate apartments or the same apartment, you may even be transferred to the highest risk pregnancy care team. Generally speaking, if you're pregnant with dichorionic twins, different houses on the same street, you'll have an ultrasound about every 4-ish weeks or so if all is going well. If you're pregnant with monochorionic, same apartment building, you'll have ultrasounds a bit more frequently because we want to make sure that both babies are getting their fair share of the resources. During these ultrasounds, we also keep an eye on your cervical length, as the more babies you're carrying, the higher the risk of going into preterm labor or of your cervix shortening prior to labor. And we'll talk a little bit more about this later. You'll also have non-stress tests. So this is when we have listens to babies and making sure their heart rate patterns are normal, and you keep an eye on fetal movements. These will get started sometimes in the early 3rd trimester to keep an eye on both of your babies. So as you can imagine, you also grow a bit more with 2 babies than you do with 1. So we often advise pregnant people that most people will need to go off work towards the end, midway through towards the end of the 2nd trimester. And of course, this depends on your work and how your babies and you are doing.
So now that we've outlined the types of twins, let's talk a little bit more about what the less fun things are about twin pregnancies. Like Alicia said, twice the fun, but also twice the risks and complications. There are 2 complications that twin pregnancies are not at an increased risk for. Those are macrosomia, so big babies, and postdates. But being pregnant with twins puts you at an increased risk of most other things. So let's briefly go through these. First things, hyperemesis gravidarum. More babies, more beta-HCG, which is the pregnancy hormone, and therefore more risk of bad nausea and vomiting in pregnancy. And it often lasts longer. Make sure you listen to our podcast around this topic. Episode 36 might help you a bit. Next up, anemia. You got it. More babies, more iron need. You can listen to our podcast around low iron and anemia in pregnancy for more information around this. It's episode 47. What about gestational diabetes? As you might remember from episode 42, the placenta affects how we manage our sugars. So having more placenta means that you're at an increased risk for gestational diabetes. Also, preeclampsia or hypertension in pregnancy. As you can imagine, the more babies, the more likely your uterus will max out on size sooner, resulting in an increased risk of preterm labor, preterm rupture of membranes, or shortened cervix in pregnancy. We'll talk about this a bit more later, but pregnant people with twins are more likely to have a cesarean section birth. And after birth, there's also an increased risk of postpartum hemorrhage. This is because of the size of the uterus, and it takes longer to cramp down and cut off the blood vessels that have nourished those beautiful babies.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back. So we've talked a little bit about risks to the pregnant person. Now let's discuss risk to the babies. So as we talked about earlier, when discussing vanishing twins, there's an increased risk of miscarriage with twin pregnancies, either with one or with both of the fetuses. There is also an increased risk for complications arising from maternal concerns that we've already discussed. So some of these include having smaller babies, being born early and needing extra support in the neonatal intensive care unit. Also potential complications of prematurity, sugar abnormalities due to being small, being early, or the increased risk of gestational diabetes in the pregnant person. There are also increased risks to those twins who are monochorionic pregnancy. So remember, in the same apartment building. And these include where one twin gets more blood flow to their part of the placenta than the other twin. This is known as twin-to-twin transfusion syndrome, which is beyond the scope of this podcast, but is one of those reasons why these pregnancies are monitored so closely. When sharing resources, those little babies, it's also possible for one baby to get more of the food resources, resulting in a difference in growth between the babies, sometimes making delivery needed early for the smaller twin. And in monoamniotic pregnancies, so this is roommates in the same apartment building, there's also an increased risk of cord accidents. There's more cords around and there's more limbs going around there. And this is also one of those reasons that we monitor these pregnancies so closely and often recommend delivering them earlier than the other type of twin pregnancies. As you can imagine, it is so important from the caregiver point of view to understand all of this and make sure that you are closely monitored, and from the patient point of view to understand this and why you're being so closely monitored. It is also very important to have open lines of communication from both sides and be able to make decisions based on the information you receive and to have trust in your care team.
So now that we have thoroughly scared you, let's talk about labor and delivery. So like we mentioned it earlier, there are issues around delivery, which hopefully will help you understand where the general recommendations around delivery for twins come from. But this is a conversation that should be ongoing between the pregnant person, their partner, and their caregiver. And it is very much an individualized conversation that takes into account many factors. So in really general terms, In terms of timing of delivery, it is recommended to deliver uncomplicated di twins, so different houses on the same street, by about 38 weeks. Uncomplicated mono-di twins between 34 and 38 weeks, and mono-mono twins between 32 to 34 weeks, if possible. In terms of the mode of delivery, this depends on a few things. For starters, like Dr. Alicia mentioned earlier, if there's a size difference between twin A, so this is typically the twin closer to the cervix, and twin B. If twin B is significantly bigger than twin A, there is a concern that the delivery may not go as smoothly as hoped for, and usually a cesarean section is advised. Generally, we want twin A to be head down, and honestly, we care less about twin B, as they often flip-flop around after twin A is delivered, and not infrequently come out breech. If they have separate houses or apartments and everything else looks good as already detailed, generally you can try for a vaginal delivery. But if they're sharing an apartment, i.e. mono-mono twins, the recommendation is absolutely to have a cesarean section, as they can get all tangled up with each other if trying for a vaginal delivery, which could really be catastrophic.
So I often think of this in the nicest terms, that they're giving themselves each other a hug, but it's really hard to get two babies hugging each other out of your vagina, which is why we recommend a cesarean section. That's the nicest way, I think, of thinking about that.
Yes, I like that. I like that visualization. Other things we like to encourage for twin delivery is that the pregnant person has a well-functioning epidural. Now, this is for a few reasons. Like we mentioned, there is a higher risk of having a cesarean section, either for both twins or sometimes for twin B, even if you've had a successful vaginal delivery of twin A. For this reason, we also prefer that for the final part of your labor and pushing, it should occur in the operating room with the team present if we need to do this. We also often have more support team members at deliveries due to the increased risk of complications, the fact that there are two babies and that they're often born preterm. So it ends up being a pretty big birthday party. Due to the fact that many twin pregnancies deliver prior to 37 weeks, many babies need some extra support in the NICU. So make sure to have a listen to our podcast about having a baby or two in the NICU, so you know a little bit more about what this can look like. That's episode 37.
Well, that was quite the synopsis. We covered what types of twin pregnancies there are, what the care looks like, the risks to both the pregnant person and the babies, and what may look a bit differently around delivery. A couple of other pieces that you may want to think about is seeing a lactation consultant prior to the birth if you're hoping to breastfeed, about what you can do to optimize your milk supply for twins, and also to really get your postpartum support plan in place. So we would like to say a huge thank you to an amazing medical student who did a lot of the research for this. Her name is Vina. So thank you, Vina, for helping us out. And we hope that that was an informative, not too frightening look at what to expect from a twin pregnancy.
Yeah. Thanks for listening, guys.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.